Imagine a disease where a simple bruise, injection, or fall can permanently turn muscle into bone. A condition so rare that many doctors never see a single case in their lifetime. This is Fibrodysplasia Ossificans Progressiva, or FOP, often called Stone Man Syndrome. FOP is not just rare. It is one of the most disabling genetic disorders known to medicine, slowly locking the body into an immovable skeleton while the mind remains fully aware. Fibrodysplasia Ossificans Progressiva is an ultra-rare genetic disorder in which soft connective tissues, including muscles, tendons, ligaments, and fascia, gradually turn into bone. This abnormal bone formation occurs outside the normal skeleton, a process known as heterotopic ossification. Over time, these extra bones restrict movement, fuse joints, and severely limit mobility. FOP affects approximately 1 in 2 million people worldwide, with no racial, ethnic, or geographic preference. FOP is caused by a mutation in the ACVR1 ALK2 gene, which plays a key role in regulating bone growth and repair. In people with FOP, this gene mistakenly signals the body to form bone after injury or inflammation, even when bone is not needed. This mutation is usually spontaneous, meaning it occurs randomly at conception, even when there is no family history of the disease. One of the earliest and most critical clues of FOP appears at birth: abnormally short or bent big toes, missing or malformed toe joints. These toe abnormalities are present in nearly all FOP patients and are often missed or misdiagnosed. As childhood begins, patients experience flare-ups, which include painful soft tissue swellings, redness, and warmth, fever, or fatigue. These flare-ups often follow minor injuries, intramuscular injections, viral illnesses, dental procedures, falls, or muscle strain. Within weeks or months, the swollen tissue hardens into bone permanently. FOP follows a predictable anatomical pattern, begins in the neck, shoulders, and upper back, moves downward to the torso and limbs. Over time, patients may lose the ability to raise their arms, bend their knees, open their mouth, jaw fusion, sit, walk, or turn their head. By early adulthood, many individuals are wheelchair-dependent. Despite its severity, FOP does not affect brain-heart muscle, smooth muscles, intestines, bladder, diaphragm, tongue, eye muscles. This selective involvement remains one of the medical mysteries of FOP. FOP is frequently misdiagnosed as cancer, fibromatosis, myositis. Soft tissue tumors, biopsies, and surgeries are extremely dangerous for FOP patients because they trigger explosive bone growth. Diagnosis is based on clinical features, especially toe abnormalities. Genetic testing for ACVR1 mutation. Early diagnosis is critical to prevent harmful interventions. Currently, there is no cure for FOP. Treatment focuses on managing pain and inflammation, preventing flare-ups, preserving mobility as long as possible. Short-term corticosteroids during flare-ups, NSAIDs for pain control. Muscle relaxants, physical therapy, gentle only. Aggressive physiotherapy is contraindicated. Several promising treatments are under clinical trials. Palovarotene, retinoic acid receptor agonist, ACVR1, inhibitors, anti-inflammatory biologics, gene-targeted therapies. While these treatments aim to slow progression, they do not reverse existing bone formation. People with FOP often live into middle adulthood, but complications may include severe respiratory restriction, chest wall immobility, pneumonia. Despite physical limitations, individuals with FOP typically have normal intelligence, strong emotional resilience, active academic and creative lives. Living with FOP requires customized wheelchairs, modified homes, careful planning to avoid injuries, avoidance of injections and surgeries. Even routine dental care must be done with extreme caution. Because FOP is so rare, lack of awareness leads to harm. Many patients suffer irreversible damage due to unnecessary surgeries, incorrect injections, delayed diagnosis. Awareness can save mobility and lives. Fibrodysplasia Ossificans Progressiva turns movement into a memory, but not hope into despair. With growing global research, advocacy, and awareness, the future holds promise. Every share, every conversation, and every clinical breakthrough brings us closer to changing the story of this devastating disease. If you found this video informative, please like, share, and subscribe to support rare disease awareness. Together, we can give a voice to those whose bodies have been silenced, but whose stories must be heard.